So good morning, I am Serapia Tionas. So today I'm going to discuss all about the effect of aging on the kidneys. So aging causes the kidneys to gradually decrease in size. So as we get older, our kidneys decrease its size. So this decrease can begin as early as age 20. But becomes obvious by age 50 and continues throughout the remainder of life. So the decrease in kidney size appears to be related to changes in the blood vessels of the kidney. So the amount of blood flowing through the kidneys gradually decreases. So the amount of blood that is flowing throughout our kidneys also decreases. So starting at age 20, there appears to be an approximately 10% decrease every 10 years. So small arteries, including the afferent and the efferent arterioles, become irregular and twisted. So functional glomeruli are destroyed. So when we say afferent arteriole is a branch of the renal artery that brings in blood to the glomerulus, while the efferent arteriole is a branch of the renal artery that drains blood away from the glomerulus. So afferent arterioles maintain the blood pressure. So it is important because it maintains our blood pressure. So efferent arterioles maintain the glomerular filtration rate. So by age 80, 30% of the glomeruli are not functioning. So glomeruli is responsible for our blood filtrations. About 30% of the glomeruli that stop functioning no longer have a lumen through which blood flows. So other glomeruli thicken and assume a structure similar to that arterioles. So some renal tubules and collecting ducts become thicker, shorter, and more irregular in structure. So the function of renal tubule is any of the long narrow tubes in the kidney that concentrate and transport urine from the nephrons. So the capacity to secrete and absorb declines and whole nephrons stop functioning. So the kidney's ability to concentrate urine gradually declines. So eventually, changes in the kidney increase the risk of dehydration because of the kidney's reduced ability to produce a concentrated urine. So the ability to eliminate the uric acid, urea, creatine, and toxins from the blood also decreases. So an age-related loss of responsiveness to ADH and to aldosterone occurs. So the kidney decreases renin secretion and has a reduced ability to participate in vitamin D synthesis, which contributes to Ce2 plus deficiency, osteoporosis, and bone fractures. So recall that 1/3 of one kidney is required to maintain homeostasis, and the additional kidney tissues beyond this constitutes our reserve capacity. Therefore, the age-related changes in the kidney reduce the kidney's reserve capacity. So as the functional kidney mass is reduced substantially in older people, high blood pressures and atherosclerosis and diabetes have a greater adverse effect. So there is a disease that affects our kidneys. It is called the acute renal failure. So it is a sudden episode of kidney failure or kidney damage that happens within a few hours or a few days. So uh, acute renal failure causes a buildup of waste products in our blood and makes it hard for our kidneys to keep the right balance of fluid in our body. So acute kidney failure occurs when our kidneys suddenly become unable to filter waste product from our blood. So when our kidneys lose their filtering ability, dangerous levels of wastes may accumulate, and our blood's chemical makeup may get out of balance. So there is a treatment for renal failure. So it is called the hemodialysis. So it is used when a person is suffering from severe acute or chronic kidney failure. So the procedure substitutes for the excretory function of the kidney. So hemodialysis is based on blood flow through tubes composed of a selectively permeable membrane. So blood is usually taken from an artery, passed through tubes of the dialysis machine, and then returned to a vein. So as you can see in this picture, during hemodialysis, blood flows through a system of tubes composed of a selectively permeable membrane. So dialysis fluid, which has a composition similar to that normal blood, except that the concentration of waste product is very low. So flows in the opposite direction on the outside of the dialysis tubes. So waste products such as urea diffuse from the blood into the dialysis fluid. So other substances such as the Na+, K+, and glucose can diffuse from the blood into the dialysis fluid if they are present in higher than normal concentrations. So because these substances are present in the dialysis fluid at the same concentration found in the normal blood. So on the outside of the dialysis tube is a fluid called dialysis fluid, which contain the same concentration of solute as normal plasma except for the metabolic waste products. So as a consequence, the metabolic wastes diffuse from the blood to the dialysis fluid. So the dialysis membrane has pores that are too small to allow plasma protein to pass through them. And because the dialysis fluid contains the same beneficial solute as the plasma, the net movement of these substances is zero. And there is other treatment for kidney failure. It is called the peritoneal dialysis. So it is sometimes used to treat kidney failure. So the principle by which peritoneal dialysis works are the same as for hemodialysis, but the dialysis fluid flows through a tube inserted into the peritoneal cavity. So the visceral and parietal peritonia act as the dialysis membrane. So waste product diffuse from the blood vessels beneath the peritoneum across the peritoneum and into the dialysis fluid. So kidney transplant are sometimes performed on people who have a severe renal failure. Often the donor has suffered an accidental death and had granted permission to have his or her kidney used for transplantation. So the major cause of kidney transplant failure is rejection by the recipient's immune system. So acute renal failure has significant effects on other organ systems in the body, as this diagram illustrates. So it can affect the integumentary, digestive, respiratory, lymphatic, cardiovascular, endocrine, nervous, muscular, and also our skeletal system. So here in table 26.5, it is the representative diseases and disorder of the urinary system. So in the kidneys disorders, it has the inflammation of the kidneys and the renal failure. So in the inflammation of the kidney, first is the glomerulonephritis. So inflammation of the filtration membrane within the renal corpuscle, causing an increase in the filtration membranes, permeability, plasma proteins, and blood cells enter the filtrate, which increases urine volume due to increased osmotic concentration of the filtrate. And second one is the acute glomerulonephritis. Often occurs 1 to 3 weeks after a severe bacterial infection, such as the staph throat, normally subsides after several days. And third one is the chronic glomerulonephritis. It is a long-term, progressive process whereby the filtration membrane thickens and is eventually replaced by connective tissue. The kidneys become non-functional. And lastly is the pyelonephritis. Often begins as a bacterial, usually the E. coli infection of the renal pelvis, which spreads to the rest of the kidney. The infection can destroy nephrons, dramatically reducing the kidney's ability to concentrate urine. And here in the renal failure, acute renal failure, in the renal failure can result from any condition that interferes with kidney function. So acute renal failures occurs when damage to the kidneys is rapid and extensive, leads to accumulation of waste in the blood. If renal failure is complete, death can occur in 1 to 2 weeks. And lastly is the chronic renal failure, caused by permanent damage to so many nephrons that the remaining nephrons are inadequate for normal kidney function, and it can result from chronic glomerulonephritis, trauma to the kidneys, tumors, or kidney stones. So that's all. Thank you for listening.